So, just a few words from me before we begin, really, especially for the new members. Um, we, we're here. What is the support group for? Well, if I start with, we've got some really good news for you. Because you really do have a physical health condition if you're at this meeting. Um, Often some of you will it will qualify legally as a hidden disability. So the good news is you're not going crazy. It's not just in your head. You're not drunk. You're not taking recreational drugs. And no one here and no one in the group is ever going to say, but you look so well, you can't be ill. So you're hopefully going to see you're in very, very good company. We also understand how annoying balance conditions are, that you can be fine one day and the next day unable to stand up. The other frustration that so many of us have lived through, you can be getting really well week after week. You can even have a great period of several months, and it all comes crashing down the next day. And it is a real life version of snakes and ladders. We also get that it's normal for your friends, your family, your co-workers. They really struggle to understand what we live with and how it invades every moment of your life. And possibly even worse than the physical symptoms, we get that many of us go through a grieving process for the olders. We have to deal with daily anxieties. We've got that fear, will we never get better? Is this it? But that is really normal to go through. And it's understand there that the words I just used, go through, it is a passing phase. This isn't a destination. This is just a temporary period in your life. And the really, really good news, some of you might not believe me today, we all get to a better place. With correct diagnosis, appropriate treatment, learning to cope with our lives and controlling that fear, we get to a much better place. So all we do at the group is share our collective knowledge. And each of you, if you're very new to a balance condition, again, you may not believe this, but we all become experts by experience. We possibly understand more than doctors and some consultants what it's like to have a condition because we live with it. And we're here to support you through the bleak times, the bad times, but get you better and to that better place sooner than you could imagine. Is there any bad news? Not really. The only chore you've got is it's like any new challenge or process. The more we work at this new thing in our life, the more we try and understand what's going on and understand what helps us and what hinders us, the better we're going to be, the quicker we're going to get there. So it's a bit like learning to ride a bike. You've got to practice a lot, but for now, strap on the stabilizers, but know that one day you won't need them. And one day you won't need this group, but I hope you've made lots of new friends who you'll take with you. So for the new people here today, sit back, relax. You are with friends. Welcome to Life on the Level. And with that, I am ready now to hand over to our esteemed guests. And if we could start with Paramita, if you could just introduce yourself, and then if you could follow that, Michaela, and then I'll put the first question to you. Thank you.
Thank you, Kevin. I'm absolutely delighted and privileged that you've invited me to this meeting, and I'm so glad that I'll have an opportunity to interact with so many people here. So my name is Paramita Baruah. I'm an ENT consultant surgeon with the NHS. I've been a doctor for over 25 years now, and I've spent 20 of those years with the NHS. I have a large balance practice because I work in the Leicester Balance Centre in the UK, which is one of the biggest balance centres in the country. We get about 7,000 new referrals of patients with balance issues to our centre. And I work with a cohort of wonderful colleagues, both clinicians and our vestibular team. So it's indeed a delight to be here to be able to have some discussions. And thank you again.
Brilliant. And Michaela.
Hi, so I'm Michaela, the balance lady. I've been working in balance, well, I was in the NHS for 25 years until this time last year where I decided it was time for me to carry on and make my influence a little more widespread and work purely privately. I was at Leicester Balance Centre, I say, for 23 years, I think it was. And yes, do a lot of work with the anxiety side of things, NLP practitioner, clinical hypnotherapist, and just generally try and help wherever I can with all things balance related.
Brilliant. And I think, Michaela, I'm right, you've been with us since the very beginning.
I have. I remember
2015.
meeting with you before you'd actually got things up and running and you were in the planning phase.
Very good.
Yes.
Quite a few years ago. So, well, I'm going to dive in. And if I just mention before I read out the first question, there are so many questions submitted. We hope to get through them all and have time to take questions from the audience, but we can't guarantee it. So let's see how we progress. And I promise if there's time, we will come back and take some supplementary questions. So the first question is really to both of you. Christmas is traditionally a busy, very social time with parties, large meals, busy family groups. Can the panel give their general top tips on how to survive this period when living with a serious or chronic balance condition?
Shall I go first on this one, Paramita?
Yeah, sure, Michaela, sure.
My suggestion with all of these things is setting boundaries. Boundaries are wonderful, wonderful things. Being able to say, yes, I'd love to come for the party if I'm feeling up for it. If I'm there, I might need to leave a little bit early and that's okay. And kind of setting those expectations that even if you're going for just a short time, it's better to go for a little bit than to avoid it completely and wish you'd gone. With places like going out for meals in restaurants, thinking about where you sit in comparison to your environment. So having your back to the majority of things going on may make it a lot more manageable if you've got a limited amount in front of you that's moving. If your hearing is poor in one side, trying to sit so that you've got people sitting to your better hearing side can make things easier. And just kind of letting yourself enjoy bits where you can and accepting where it's a bit more difficult, being able to say, okay, I've had enough and I'm done for today, and that's all right. Potentially, and this is where you may or may not agree with me, Paramita. Sometimes, I mean, with balance rehab, we always say we don't want to suppress the balance system with medication because we need to stimulate it to help improve it with the vestibular rehab. But vestibular suppressants do have their place. And sometimes, on the odd occasion, do you know what? If you need to take some medication to get you through that one day, that one important thing that you really want to do, and you're wanting to make sure you're feeling okay with it, do you know what? Travel sickness tablets or whichever form of medication that your GP or the consultants give you on occasional use, you know what? Go for it.
I agree, Michaela. I mean, that's very good advice. And yes, I would not, as you said, I wouldn't suggest medications over a long period of time, but 1 or 2 days to get over, a difficult period, or we do give medications for acute episodes or like the severe episodes of dizziness for a few days. So that's absolutely fine. I was also going to suggest, like, for example, people who have, migraine-related vertigo, like vestibular migraine, etc. The bright lights, noise, any stress related to attending these functions can actually trigger your disease symptoms, and it's a good idea to try and get plenty of rest before you actually go to an event, which might trigger some of your symptoms, and try and get a good night's sleep. Sometimes easier said than done, but have a period of relaxation before the actual event, and make sure that you are well hydrated, because dehydration can affect symptoms as well. If you're going to take alcohol, red wine can worsen some of the disease symptoms, and just be aware of that. Caffeine is the same. So food and drink, some moderation, and again, watch out for the salty food. So just a few things that could potentially help trigger symptoms, but Michaela has given a really good plan of action there.
Excellent. That's great. Thank you. I'm relieved to self-medicate with Rioja red wine. So it's good to hear that that's following medical advice. The next question is kind of related. This is from a member who wanted to remain anonymous. I have a large extended family. Most live a significant distance away. Traditionally, my husband and I have always driven to visit, but my symptoms are so bad this year, I can't face the prospect of travelling. I've deliberately not told many of my family about my own health problems. So can you give me advice on how to explain this for the first time, that it would be good if my relatives and friends could visit me and save me the anxiety and horrors of travelling? If we'd start with Paramita first, please.
I think the two aspects here that I was thinking about. So one is obviously, how do you tell your family and your friends about your condition? And I think while I accept that you don't have to tell in great detail about the condition, it's good to be able to communicate to them what can be expected, and what you struggle with. And I think that if people are told these, the restrictions one might have, they're generally understanding, and therefore I would one of the suggestions would be to have an open conversation about what you're comfortable doing, and what can potentially cause you symptoms. The other aspect is, of course, with traveling itself, and again, it's if travel is a trigger, then what can be done to work around it, and many of the things that we mentioned in response to the first query, with regard to reducing stress around travel. So, if possible, planning in advance, making sure you get enough rest, making sure that you're not getting dehydrated, because traveling, especially long distances, can cause issues around, whether you're getting, whether you're eating at the right times, etc. So to have snacks so that you don't, your blood glucose doesn't vary too much. And again, it's about doing what you're comfortable with. So my suggestions would be to have a good conversation with all the people, and work out what works out best for you, and the rest of the family.
Great. Michaela, please.
I mean, that's covered things really, really beautifully. I think the couple of things I would particularly add is, firstly, you don't need permission to do what's right for you. You don't need permission to say, I'm staying at home this year. People are welcome to come and visit me if you wish to, but this is what I'm doing, because for whatever reason, this is what I'm doing. And secondly, you don't have to absolutely justify. You don't have to make it okay by everybody else that actually you're not well enough to be able to do long travel or participate in some of these activities that you don't feel up to doing. You've got to do what's right for you. And it is okay to say, this year, this is what I'm doing because this is what I feel I need to. And you don't have to give more than that if you don't feel you're wanting to or you're not able to share. Absolutely, if you're able to have that open conversation, fantastic. But you've got to do what's right for you and yeah, try and make it as pleasant as possible.
Yep, lovely both. If I can just add, and some of the longer serving members will probably guess my attitude, put yourself first. Don't be embarrassed. Don't feel any shame. If you got 2 broken legs and somebody said, shall we go for a walk? You'd soon let them know. So the trouble is you don't walk around with a bandage on your head. And unless you tell people what you're going through and what it's stopping you doing, they're not going to know. And don't get me wrong, when I first went down with Meniere's, I was the world's worst at trying to hide it, even from myself. But what I've learned is people are far more receptive, supportive and positive than we give them credit for. And if you can just explain what you can and you can't do or what you try and do, and to relieve the anxiety, give them pre-warning. Say, look, Christmas Day, really special, but if I'm not feeling well, it's going to be very limited what I can do. So remember, it's not your fault, but don't make it worse upon yourself. Just be brave enough to communicate what's going on. But thanks, but really, really great advice. Into first specific question now. This is from Len. Symptoms for years. I've seen many medical professionals over the years, tried numerous medications, and I've tried and continue to try a large number of physio exercises. My symptoms continue to worsen and now include retained image vision, ripple vision. I've been advised many times to take amitriptyline up to 6 a day, but this medication makes me feel very strange, so I rarely use it, other than try and help me sleep on occasions. Medical professionals then seem to give up on me as a result of not taking this medication. Can amitriptyline make a tangible difference, and will taking it in these quantities eventually make you get used to the side effects? I'm currently taking 2 cynarazine tablets daily. And Paramita, please.
Thank you for asking this question, Len. I mean, obviously, I do not know the entire background, medical background here. And there are certain things that you have mentioned in your symptoms. One is the retained image vision and ripple vision. And I just want to suggest, in case you have not already seen somebody for this, that you need to see a neurologist or a neuro-ophthalmologist, because the visual symptoms that you're describing are quite important symptoms, and they can link in with some rare conditions, and therefore the people with expertise in that area would be the neurologist and the neuro-ophthalmologist. So I would definitely suggest that if you haven't already consulted somebody in that field, to please do so. I will not go into what various diagnoses can be, because it's best that you're seen by somebody, of course. But you did ask about amitriptyline. Now, amitriptyline is a medication that I do use in my practice with balance patients, and generally amitriptyline is prescribed for migraine-related balance issues, so vestibular migraine, and it is one of the medications which can be given in this condition. And I do get patients who don't tolerate it that well. They don't get along with it that well. It's a medication that takes time to build up a response. So you start with a lower dose and you continue for a few weeks, then you build up the dose until you take the maximum tolerated dose, and then you see if your symptoms are getting better. And this can take 6 to 8 weeks at least to start seeing an effect. However, people may not tolerate it, and there are other medications which are alternative medications, and your doctor should be able to switch to a different medication if amitriptyline is not helping for the particular condition. We touched upon taking vestibular sedatives, which is cinnarizine is a vestibular sedative. And while, for a very bad episode or for, trying to prevent an attack coming on, if you're expecting, such stressful situations, so taking it for a few days is okay. But if you take a vestibular sedative for a very long time, that can actually have a worse effect on balance, because whatever be the cause of the balance, whatever be, say a damage to the inner ear, or, any episode which can cause dizziness, one of the things that the body does, the brain does really, is adapt to the new situation, to reset the balance mechanism. And that doesn't really happen if you are sedating the balance organs. And while you can do that when it's really bad episode, but if you do that on a daily basis, it can prevent that adaptation, which is why we don't recommend cinnarizine daily. But these are my general thoughts. Obviously, I'm going by what the information is in your question. But my main advice would be that please do see a neuro-ophthalmologist or a neurologist for the eye symptoms that you've described. And there are other medications, alternative medications, which your doctor should be able to help you with.
Lovely. Paramita, I think you've answered Len's part two of the question was, is there something in the background that can be causing the problem? Should MRI scans or others be looking at this? And I think you've already suggested yes.
So I think a visit to a neurologist and an MRI scan to kind of make sure that there's nothing else going on is a very reasonable thing to do.
Yeah,
good.
I have probably already seen 3 or maybe 4 neurologists in different parts of the country, but what tends to happen is they just say, yeah, it's 3PD, get on with it, drink more. Is essentially where I'm at the moment, which you can imagine the frustration.
Yeah. There is another question on 3PD later on, though I'm happy to talk about it now.
Let's not jump out of order. Just back on Len's point there, where you get this response of just get on with it. As a patient, I've always believed, well, if I'm not happy with that, I've got to keep fighting. And whether I need to get a second opinion, is that the way to go for Len at the moment?
Yeah, I mean, absolutely. I think there has to be engagement, obviously, from the medical team looking after you, because otherwise it becomes really challenging. And if you're not getting somebody willing to look at changing a medication to try and help with your symptoms, then certainly another opinion is the next reasonable step. I mean, Len did say that he's already seen quite a few people, and I can understand that might be getting frustrating. I
would say that I've met so many members over the years. They've had such frustrating journeys.
Yeah.
And the one thing I always go back to is you kind of know your own body better than most, and you've got to keep fighting. I know it's hard, it's difficult, but I just think the day we give up, it just doesn't serve anyone. We get nowhere. So it's just fight and keep fighting and keep seeing people. But I know it's very difficult. I totally get that. Len, thanks very much for your question. We're going to have to move on just to try and get all these other questions in. Let me just take that off. The question for both of you. This one's probably an easier, quicker answer. Does my anticipation of problems at Christmas time due to my symptoms make me worse at Christmas? Or does thinking ahead make it less of a shock? Both of you. Start with Michaela, please.
The very short answer to that question is yes.
Yes.
to both parts of it. So yeah, the building the stress up and building the anxiety as to what might happen will certainly make you feel worse with your balance. If you're concentrating on the, oh my God, everything's going to be so bad, it's all going to be awful, because your stress level will just keep hiking up. If you're able to take that step back and say, okay, these are the difficulties I'm anticipating, and trying to put into place plans for it. So if you know you're going to a particular restaurant, being able to plan where you're going to sit so you can have most of the activity behind you, or if you can plan how long you're going to stay for, all of these kinds of things to try and make things as easy as you can for yourself, then that will make it a lot easier. So yes, stress will make you feel much worse if you let it just stress, but if you use it as a means to try and make things easier, then the planning will make things much easier.
Great. Paramita, anything to add there?
I think I absolutely agree with Michaela. I don't have anything further to add here. I think thinking about it gives you an opportunity to actually prepare for the event, and as she said, there's this any anxiety or stress related to an event, and that happens to me as well. A bit of anxiety is good because it helps you prepare. And at the end, I do try and compartmentalize my worries sometimes to try and, use it for the greater good.
Yeah, it's very difficult, isn't it? It's think about it enough to help plan, but don't think too much about it all the time, every minute, or it will be counterproductive. Brilliant. Next question. This is for you, Paramita, from Jill. Neurologist diagnosed triple PD, amongst other issues, arthritis, etc., a year ago. I wonder if anyone has knowledge and experience of what maybe has generally helped them. So really, it's general advice for people with triple PD.
Yeah, so yes, I do see patients with triple PD, and it's not the easiest diagnosis to make, and it has, there's a group of symptoms that people come with, and it can be fairly debilitating, and so it's a group of symptoms which can arise due to different causes, and that makes its treatment a bit more challenging as well. So you may have had a vestibular issue, that's an issue with the inner ear, which has left which has led on to a development of these balance symptoms, which are classified as triple PD. Or it might have been a neurological event, for example, a mini stroke or something, which then leads on to these kind of symptoms. So the treatment of triple PD tends to be a holistic approach, and if there has been inner ear insult at some point of time, for example, somebody's had crystals in the inner ear, BPPV, which has settled but has left with what we call the brain processing of balance. And in that situation, vestibular rehabilitation, and Michaela will be able to talk about it, can bring a lot of benefit. There is there can be quite a bit of anxiety related to symptoms, which can worsen the triple PD, and cognitive behavior therapy can help there as well. There are some medications. The one that we tend to use in our own practice is called venlafaxine. So that does help with the anxiety element of triple PD. And this is what we have at the present time in trying to address these issues. And a lot of people do get benefit from vestibular rehabilitation. Mikola, what is your experience here?
So a lot of the triple PD patients that I see, we do a lot with vestibular rehab. We also do an awful lot with the anxiety response, things like mindfulness. Various relaxation and breathing techniques can be really, really helpful. A lot of the difficulty with triple PD is that hypersensitivity of the brain to lots of bodily and environmental sensations, and trying to help desensitize to an extent that, and to kind of allow that stress response to lessen, as you say, with medication, with CBT of a variety of forms, vestibular rehab. So it's very much a case, I think, of needing to see somebody that knows what they're doing with balance issues and with all the parts involved in triple PD. I think the difficulty, just thinking back to what we were talking about with Len, is that people often get sent through to people that their speciality, their main interest isn't in vestibular difficulties, and potentially more kind of a generalized approach to things. Balance is so important that you find the specialist whose interest and speciality is in what you are experiencing. So find someone that their whole thing is balance issues, or the neurological component. See someone that specialises.
Very good. Thank you both for that. On to a question to put to both of you. And again, this is so common over the years from many members. Question anonymous from a member. Some members of my family make comments that lead me to believe that they may think I'm making up some or all of my symptoms of my illness. They won't directly say this to me, but what can I do to help convince them that this is a real illness? Paramita first, please.
This is really a difficult place to be in, isn't it? When you have these symptoms which are causing you a lot of difficulties, and the people who are important to you seem not to be able to understand it. And I think this is the entire issue around balance issues, balance problems, because it's not a visible illness. And I think the only way around it really is communication, education, have a frank discussion with the family, ask members of the family if that's okay with you to accompany you when you go and visit a clinician, or the physiotherapist or the vestibular rehabilitation team. We do have in our clinics quite a lot of information about various balance disorders, information leaflets which you can share with your family member. And I think communication really is key here. But at the end of the day, as Mikola said before, you are the important person in this equation, and you are suffering from a disease, and you don't have to prove it to others all the time, if I may say so. But yes, so don't feel guilty, or don't feel you don't really need. Well, this is probably a personal view. You don't really need validation all the time. But get them on board if possible, and communicate and give them the information. I'm more than happy in my clinics to speak with family members as well, to inform them about what the condition is and how it can affect the sufferer. Do you have anything to add here, Michaela?
Certainly, I would certainly say always be very, very careful in the mindset of I think that they think that I think, because we don't know what other people are thinking. We can sometimes get a good idea, but often it's not as good as we think it is. We are really not good mind readers. So good communication is absolutely the key thing. If there's something you want to talk to them about, or you think that they're thinking something, ask them, speak to them, and have that conversation if you can. If you can't have that conversation, then sometimes you just have to go well, I don't actually care what they think, because it's not necessarily correct, and I'm doing the best that I can.
Brilliant. I did put on the chat while we were talking. This has been done by a few members before. They've just asked friends or family to watch some parts of our past meeting recordings. And it's very strange because your family and friends see other people saying what you've been saying. Suddenly they start believing it, but it is a thing. I don't know what that is. We tend not to believe our nearest and dearest, but if a complete stranger comes along and goes, I've got this problem, it suddenly is more acceptable. And I've always volunteered this to every member. If you really are struggling, I'll speak to anyone and just explain what members go through and the general horrors of trying to live with these hidden illnesses. Great. Let's move on. Naomi has asked, is there any connection between low cortisol levels and vestibular migraine stroke balance disorders that you know of or have witnessed? Paramita, please.
Thank you, Patricia. I must say that
Naomi. It's Naomi.
Sorry, Naomi, sorry. I must say that, Naomi, I had to go back and read up a bit when you asked me this question, because it isn't an obvious link. I mean, when I see patients in my clinics, I do not automatically go, oh, let's get your blood cortisol levels done to see if this may be causing your symptom, because usually with ear-related balance issues, I'm not thinking of low cortisol levels, but low cortisol levels can affect your overall balance. For example, not necessarily in a ear-related, but can cause something like Addison's disease, for example, where you have low mineralocorticoid levels. Your blood pressure can vary, and if you stand up quite quickly, you can have what is called postural hypotension. So your blood pressure drops when you stand up quickly, and that can be quite difficult in your day-to-day life. And it can, so steroids, low cortisol levels can cause that kind of those kind of issues. Can and steroids are involved in the body's stress response. So if there is a stressful event, you tend to get steroid overload, and that could potentially trigger migraine as well. But it's not something I look for on a regular basis. And if in my assessment I find that somebody has low blood pressure on standing up, I generally send them to my medical colleagues who deal with issues around the function of the various things which maintain your blood pressure. So they would pick up low cortisols there. On the converse side, we do use steroids to treat a lot of ear-related disease symptoms. For example, we inject steroids into the ear to treat Meniere's disease. So there is a role for steroids definitely in the balance mechanisms, but not I don't have any clear evidence in literature that it results in specific migraine or ear-related balance issues. I hope this answers your question.
Lovely, thanks. Next question from Patricia. Is my functional movement disorder due to my complex PTSD or my bilateral vestibular failure? I also suffer from vestibular migraine and hearing loss. I'm not sure you can answer that without meeting the patient, but I'll let you have a go at that parameter, please, Paramita.
Right. Yes. So thank you for the question, Patricia. Functional movement disorder is outside my own expertise. Really, it's what the neurologists are usually able to help with, because this is functional movement disorder is a really large category with different types in it, and there may be various factors which lead up to the diagnosis. Can bilateral vestibular failure lead to functional movement disorder? I cannot answer that with any certainty, because bilateral vestibular failure results in certain symptoms related to your balance. But as far as I'm aware, there is no clear link to functional movement disorder as well. But that's probably the remit of a neurologist's experience in this area to be able to give you more defined answers.
Super. And moving on, because I'm just conscious so many questions to get through. From Rebecca, are there any foods or vitamins to avoid when you have symptoms such as tinnitus or a condition of Meniere's? Conversely, are there any foods or vitamins that would be considered beneficial? Michaela, please.
I think the main ones are, for Meniere's, we advise a low sodium diet, so trying to keep your salt levels down, so no added salt at the table, try not to add it to cooking, a lot of label watching, unfortunately, and no caffeine. So tea, coffee, you can have decaffeinated, but decaffeinated only. Things like cola, energy drinks have a lot of caffeine in, so none of that. So that's the one for Meniere's. Tinnitus, caffeine and alcohol can be big ones for tinnitus, dietary wise. The only thing we may suggest that people include into the diet more is things like vitamin D can be helpful when people have chronic BPPV. But generally, a nice, ordinary, healthy, balanced diet, or the normal advice that's given with regards to kind of any balance things.
Super. Good. I can vouch. Meniere's, definitely keep off the salt. The only thing I would say is keep testing and retesting. So if, for example, you have one square of chocolate 4 years ago and a bad response, I wouldn't give up chocolate for life. Life's too valuable for that. And as any scientist will tell you, you have to keep doing some sort of testing and controls of these tests. Otherwise, you can incorrectly relate a bad day with something you've done or eaten. You've got to try and find ways in the future of retesting it, however much that might alarm you. And one last thing, no one's asked a question about this year, but there is such a thing. I believe you may term it hypervigilance in the medical world. I was awful for this. When I went down with my condition, I analysed everything from the moment I woke up to the moment I fell asleep. How many breaths per minute? What was the air pressure? What am I drinking? How much am I drinking? And I've got to be honest, other than salt, nothing else ever helped me. So I wasted years of my life monitoring things that were of no benefit. So it's just a word of warning there, that as much as we need to log and record things, let's not go over the top. Something now for Michaela again, quite an interesting one on this. Anonymous, I am still a keen cyclist. I understand that driving a vehicle is an issue if you experience sudden and violent vertigo attacks. I don't have such attacks, but I do get periods of off balance. Is it legal to still ride my bike at this time?
See, now this is a fab question because I've been asked an awful lot about the driving side of things, and the DVLA are beautifully clear in their website as to when you can and can't drive. But the cycling side of things that's a fantastic question. So I actually spoke to a traffic officer that I know, and I shall read out their response. They sent me the kind of the clip out of the. Hang on, I'm just trying to find which where he says it comes from. This definition it's public information and contained within the Road Traffic Act 1988. There is a newer edition, particularly about new laws with regards to cyclists, but this is the one that currently is worked from. So cycling offences. Currently, cyclists may be prosecuted for criminal offences under the Road Traffic Act 1988, including the following offences targeted at cyclists: dangerous cycling, careless or inconsiderate cycling, cycling when under the influence of drink or drugs. The definition in the 1988 Act of what constitutes dangerous cycling is based on the expectations of a competent and careful cyclist. Under the provisions in the Act, cycling is dangerous if someone is riding in a way which falls far below what would be expected of a competent, careful cyclist, and that would be obviously dangerous to a competent and careful cyclist. Careless or inconsiderate cycling is defined in this Act as riding without due care and attention or without reasonable consideration for other persons using the road. So both mine and his take on that would be that if you are cycling when you know you are not fit to do so, so if you know that you are feeling very off balance that day, then potentially if you caused an accident or you hit somebody while cycling or falling off your bike, then potentially there could be legal ramifications from it. When you are generally, people are pretty okay cycling with balance, but it's taking that common sense approach. What I would suggest is, if you're looking at getting back into cycling, make sure you're going somewhere initially, somewhere quiet, somewhere safe. So places like parks with paths, so you're not at the risk of veering off into the path of a car or risk any that way. Start somewhere nice and quiet and safe, build yourself up, make sure you are feeling confident and safe. So it's a common sense applies, but that's what he told me.
Brilliant. Makes a lot of sense. And I'd say number one, foremost, don't put yourself in any form of danger. When I started on my mountain bike again, it was in very quiet country lanes. But it was good. Finally got rid of the stabilizers. Good news.
And helmets are always a very, very good thing.
Yeah, totally agree. Totally agree. Moving quickly on, because we've still got so many questions. We have 3 questions from Juliana, so going to have to motor through these. All for Paramita. Juliana says, I have vestibular neuronitis. Can targeted exercises be fine even when experiencing dizziness and or on a bad day? Would that be you, Michaela?
I was actually going to direct it to Michaela.
Michaela, you do that one.
So can the exercises be done on a bad day? Yes, they can. The more consistent you are with the exercises, the more repetitively you do them, the more effective they are. Certainly if you're having a really bad day and you are feeling really unwell, then absolutely having a day off because you're really unwell, that's fine. But if it's because your balance isn't feeling all that nice and I don't really want to, still do the exercises. It's worth it.
And then part 2 to this, Michaela, when doing exercises, can dizziness be also a symptom caused by the exercises and be a sign of recovery? If that is the case, how can you tell when the dizziness is caused by the exercises or caused by the condition?
So certainly the exercises are designed to stimulate the balance, which will therefore make you feel a bit off and dizzy or off balance, whichever term that you choose to use. They will make you feel off with your balance. And it's a good sign. It shows we are on the right lines. We are doing the right thing. Keep going with them. With regards to being able to tell whether it's the exercises that making you feel dizzy or whether it's something else, generally when it's the exercises, it's usually whilst you're doing the exercises or for a short time after. It doesn't tend to go on and on and on. But having said that, the increase in stress levels sometimes and tiredness and all these kinds of things will have an impact on how you feel with balance and will make you feel a bit more off balance. But actually, it kind of doesn't really matter where it's coming from in between. It's the treating it and kind of keep going with the exercises. Obviously, there's fluctuating problems like Meniere's migraine and BPPV. That's a slightly separate issue. But as a general rule, keep going with the exercises, even if they don't feel good, because it's a good sign.
Great. And the third final part, and I love this question, could moving to a country with a milder climate and more sunshine help vestibular conditions go away faster and speed up recovery?
As a very short answer, I will say no, but I will actually pass that one back to you, Kevin.
Well, I'm totally biased here because I truly believe I've not found a consultant who necessarily agrees with me. My Meniere's was far worse in the winter when my head was exposed to the cold. My theory is all my little vessels shut down on the outer side, and I just had more symptoms or noticed symptoms greater. So I'm currently sitting somewhere quite warm to escape some of the winter. So in my opinion, even if it doesn't technically cure you, you feel a hell of a lot better. And that's good for me. But I've got no medical evidence for that one, I'm afraid. Paramita, any thoughts on warmer climates and balance?
I think one should probably do a study where people look at how often people suffer from Meniere's in warm countries as opposed to cold countries. Maybe that will be evidence-based. I think generally you feel better in a warm country because winters can trigger many other symptoms as well. So, but as you said, there is no evidence either way.
Sadly, but I love the sunshine. Next question for you, Paramita, from Jim. I've read that sometimes dizziness can be triggered by lactose intolerance. I wondered if this is something others have experienced. I'm cutting out lactose for a few weeks just in case this has a positive impact.
Thank you for the question, Jim. I think if I was to Google any foodstuff and look at a link with dizziness, there will be some mention or other of a foodstuff, triggering dizziness. So I don't think the evidence that lactose intolerance can cause dizziness is very strong, but you can't really rule it out either. And it's all about looking at your own symptoms and your own diet. And maintaining a food diary is something I advise my patients very often. So if you feel that lactose could be causing you problems, I think you're doing the right thing. Cut it out for a few weeks and see if you are symptomatically better. Then you can reintroduce it and see if your symptoms return. And that could act as proof of principle for yourself. But I don't think there is any. I can't apply it potentially as a general rule that it would result necessarily in an issue with everybody. But certainly you're doing the right thing to try.
And from Jim again, I normally wear earplugs while sleeping as I'm a light sleeper. I use Snorecalm foam earplugs from British Snoring. I've done this for many years. I recently read online, and I'll put on the chat the article, Boots Hearing article. that in doing so, sleeping with earplugs can cause all sorts of issues, such as tinnitus, hearing loss, and dizziness, and may even lead to permanent issues. Could you please comment on this?
Yes, thank you, Jim, again for this question. I did go and check the Boots article when I saw this question, and we tend to advise earplugs very often to our patients for various reasons. One of the commonest things, because I operate on the ear, is to avoid any water getting in, and that's one of the commonest reasons I suggest earplugs. And I know that people use it for various things like noise sensitivity, etc. I think the point that the Boots article was making was about the fact that you can get wax buildup, or if the actual plug is damaged or it's worn out, it's dirty, it can trigger ear infections, and therefore the wax and the ear infections could have a secondary effect, resulting in, say, tinnitus or hearing damage, rather than a direct effect of the wearing of the earplug itself. What advice I tend to give people when they wear earplugs is not to use them 24/7. So essentially, when you use a earplug, you trap moisture within the ear canal, because your ear canal is lined by skin, which sweats. So you have to give breathing space to your ear canal. And therefore, if you're using earplugs, do use them when you absolutely need them. But when you don't, give your ear some breathing space. And that would be my suggestion.
Super, thank you. Question for both of you, and I think this is going to be a general advice for people with vestibular migraine. It's anonymous. This will be my third Christmas with my balance condition, suspected vestibular migraine. What can I do to try and make this the last Christmas where my condition interferes so much? In other words, what do you recommend I do, I try, or practice to get as much reduction in the level of my symptoms, please? Michaela first, because I know Paramita will give us the medical. What's your take on that? Vestibular migraine. Last Christmas to be bothered by it.
My first suggestion would be making sure you've got the appropriate medical control of the migraine itself. Any triggers that you're aware of, trying to limit those as much as you can. So things like getting a good night's sleep, getting enough sleep, trying to keep your stress levels down, trying to have a normal, decent, healthy diet. Pacing yourself is a really, really important one at Christmas. We tend to get into the mindset of we got to go and do all the Christmas shopping, then come back and then wrap everything and then get everything hidden away and then go and do dinner, and it's too much. Pace yourself, do a little bit of an activity, and then give your brain a bit of space, bit of breathing space to just settle and relax again. And just taking good care of yourself.
Paramita?
Yeah, so I think Miklas hit the nail on its head, really. Those are the kind of things you need to look at to prevent, things getting worse when you're expecting something that might be stressful. The question around medication is with vestibular migraine is really linked to how often you actually get the symptoms, and not necessarily linked to whether you're going to get it at Christmas. If you're getting several episodes over a period of time, then you may want to talk to your doctor about what is called prophylactic medication, which is not, when it's vestibular migraine, it's not dissimilar to what is used for classical migraine, and being on a prophylactic medication. For example, amitriptyline is one of the first lines, or propranolol, for example, but your doctor can guide you better. And you can be on prophylactic medication, which would hopefully help prevent an attack around Christmas as well. But if you're otherwise okay and you get one episode at Christmas, or one of the few rare ones around Christmas, then everything that Michaela has said is absolutely on point.
Good. Thank you very much. Question from Alison. I have had 2 gentamicin injections for unilateral Meniere's. These have stopped the debilitating Meniere's attacks, but have left me with occasional bouts of dizziness, spinning. They only last for a few seconds, but leave me with a heavy head and headaches lasting a couple of days. Are these bouts to be expected after gentamicin, or could they be remnants of Meniere's? I am doing regular vestibular rehab exercises. Paramita, please.
Thank you, Alison. That's a very important question. So we do treat our patients with Meniere's with gentamicin injection, and it's important to understand what gentamicin does. Gentamicin works by actually destroying the inner ear tissue, the inner ear balance tissue, and the reason we use gentamicin for this purpose is because it kind of leaves the hearing tissue okay while destroying the balance tissue. And we want to destroy the balance tissue because we believe that the Meniere's episodes, the dizzy spells, are triggered because this balance tissue is getting activated, and it's kind of, it's whatever, it's inflamed, it's activated, and it's triggering these symptoms. So the idea is that if we damage this tissue so that there's no such tissue left, the Meniere's symptoms would settle down. But what that does do, while it takes care of the acute episodes, is that it has now left you with a balance organ on that one side, which is not functioning as well as the other. And there is an imbalance. And I tend to explain to my patients that it's like you're flying with one engine of your plane not working as well as the other. And your plane can still fly and do fine if it's fair weather. But if there's a turbulence, there's going to be a bit of a struggle. And when you're having a not particularly good day for another reason, your balance might feel worse than usual. It can leave you fatigued, it can leave you tired because your brain is working overtime, and that can result in headaches as well. So yes, vestibular exercises is very, very important here so that your brain can adapt to the fact that you're working with an imbalance between your right and your left ear. The other thing to mention here is that migraine can overlap quite a lot with Meniere's symptoms. So if you're getting very frequent headaches, it's worth discussing with your doctor whether you might be also experiencing some migraine symptoms, and treating that in addition to your Meniere's may give you better symptom relief.
Super. Very good, thank you. Again, for you, Paramita, a question from Jean. Since I had my right ear washed out at a GP surgery a few years ago, I have been left with hearing loss, poor balance, and feeling of fullness in my ear. I've had hearing tests and been told that I cannot be prescribed a hearing aid. Such problems when crossing the road as moving my head to see traffic, and I get very unbalanced. This all makes me so anxious to go out, and I put off going anywhere unfamiliar. I'd be very grateful for the advice from the panel. So Paramita, I think for you.
Okay, thank you, Jean. I must say that in our own medical setup, we have stopped doing ear washes with syringing because occasionally syringing can cause damage to the eardrum, etc. Now, obviously, I do not know what the current condition of your eardrum and the ear is, but if we say that the syringing has left some damage to the ear, you could potentially be left with hearing loss if it's damaged the eardrum. With balance, for syringing to trigger balance issues is not that common. It'll have to be a fair bit of damage, and again, it's difficult to give you any details without actually being able to examine the ear. And again, when you have been told that you cannot be prescribed a hearing aid, is it because your hearing loss is so bad and the hearing aid cannot help, or are they saying that hearing aid would be difficult to use if you have a hole in the eardrum? So there are a bit of issues which will need to be teased out here. But what I would suggest is that if you're currently seeing your GP for this, that you do ask to be referred for an ENT consultation slash a ENT balance expert consultation, so that they can examine your ears and do the balance testing, etc., to see what the balance function in your ear is like. And that would determine how we can then progress with helping you with your symptoms.
Great, thanks, Paramita. And then another one for you, Paramita. Andy asks, after more than 3 years, I am still waiting for an appointment with a neuro-otologist. My GP thinks I have triple PD. My 15-year-old daughter is now on her third bout of a disturbingly similar list of symptoms as myself, lasting between 4 to 12 weeks. My father was a mild sufferer of Meniere's. Is there anything to suggest a generic inheritance of vestibular problems?
Thank you, Andy. This is actually a brilliant question. I mean, as somebody who deals with both hearing problems and balance problems, there is a huge amount of literature, clear evidence that there is a genetic link to hearing loss. But unfortunately, a genetic link to vestibular balance problems is less clear. I think part of the challenge is that vestibular problems themselves are very hard to measure and diagnose, and they can be vestibular problems is a very large category of things that can affect the balance. Having said that, there are a few conditions where there appears to be a genetic link, and actually Meniere's is one of them. Again, it's not strong evidence-based. There isn't a single gene that has been identified which will link to it, but there is evidence for familial Meniere's amongst a couple of other conditions which are more which have clearer genetic gene-related hearing and balance issues, which run in families. So the answer to your question is there anything to suggest a genetic inheritance? Yes and no. So there are certain conditions which it's a definite yes, which are really one or two, and others where it is suspected but it's not clear-cut. And hopefully, as we understand more about balance and we understand more about how genetics influences it, we'll get more answers come through.
Lovely, thanks. I would add there, and I've had a conversation over a few years on this, that as interesting and as valuable sometimes to know why things happen, I always find it so much more important to be able to access treatment for them. The why I say is almost academic, the treatments here and now in my life. And it's shocking to see Andy's been waiting for more than 3 years. And part two of Andy's question here is that he's asked his GP to refer him to neuro-otology at UCH London. But the doctor says he can't do that as Andy's outside the catchment area. But the UCH website says it will accept referrals from all over the country. So Andy's asking the question, how do I get a referral? What do I do? And this, I assure you, has been happening all around the country where people are waiting so long. And there was, I can't remember if it was last year or earlier this year, where we were all told the waiting list will crumble because you can now go and be referred anywhere you want. Well, that was assuming there were lots of spaces anywhere else, which I don't think there are. But what's the answer there? How does Andy get that referral? Or can't he? Because even though it says on the website you can be, they've got no spaces. Answers, please. Paramita. And he's
This is indeed a very difficult situation, isn't it? All of our patients are waiting so long to get appointments. So I'm not sure why your GP is refusing to refer you, because certainly they should be able to refer you even outside your closest hospital. So I don't know exactly what's going on there, but certainly your GP, if they have referred you to an ENT consultant, the ENT consultant can then ask for a second opinion from any other larger center, and we at Leicester Balance Center do get second opinion requests from the local ENT teams. So that is one possible avenue. I don't know what the website of UCL mentions, but if there is any contact detail on it, you could potentially contact them directly to ask if you can make a self-referral, because lots of units accept that these days. And if not, if the information can be provided to your GP to make a referral to them directly, they might have more knowledge about their own referral pathways and how they can get you to see them, essentially.
super. Thanks for that. Question for you.
I'm just going to jump in there, sorry, Kevin, just to point out that I know it's not ideal for a lot of people, but the other option is seeking private opinion. You can self-refer to a consultant that specialises in whatever field on a private basis, even if it's just an initial consultation with them to hopefully get an idea of potential diagnosis, and then await an NHS appointment from there if that's required, or seeking kind of treatment on the private side of things. But I know it's not ideal, and obviously there is the cost implication in that, but sometimes it's just worth the money just to get the answer that you need.
Yeah, I tell you from personal experience, we've been going over 5 years. It's at least 4 or 5 members a year pluck up the courage to and find the money, obviously. But first appointments, obviously not including tests, it can be the same as taking a large family for a meal in a restaurant. You get to see a really great balance expert who can start unlocking the problem. But 4 or 5 members a year I know have gone down the private route, and they're so glad they did. It's so difficult. We as a group can't advocate spending anyone's money, and it's down to personal circumstances what you can afford. But I tell you, there are many examples out there where they're so glad they did, because what price having your life in limbo for so many years? It's very difficult. And it's not the right answer. We all know what the answer should be, but I think we're still a few years away from getting to a better place in terms of faster treatment. Moving on, Michaela, this is for you. I have had a balanced illness several years. My life has been badly affected in many ways. One knock-on effect of this is that my partner and I have had the added stress of my illness and limitations on what I can do. This stress leads to probably more arguments between us than we would normally have had. After such arguments, I seem to have worse symptoms. Is this normal? And what can I or we do to try and avoid such arguments?
It is absolutely normal. The reason that you feel worse after the arguments is because your stress levels is so much higher. And stress in its own right will cause feelings of dizziness. So add that on top of your general balance problem anyway, you're going to feel much, much worse. So the key to it is, again, it's going to be really good communication between both yourself and your partner, and having that open conversation as to what you're both feeling, what difficulties you're both experiencing, and working together to try and find what works for both of you. There's no one answer to that, and there's no quick fix to it. I know with this support group, there is that contact for partners to be involved in this, because it is so important that they get the support they need as well, because they don't know what you're feeling. They can't know what difficulties you have, because it's an invisible illness. You can't imagine what a balance problem is going to be like when you've never had one, because you can't see it and you don't realize that you rely on your balance for everything all the time, and it's tiring and it's frustrating and it's upsetting. So if your partner's open to it, bringing them on board with the support group, show them the meetings and the questions and the experiences people have on here. I've had quite a few of my clients say that they've had their partner watch a video that I did with RuPaul a good number of years ago, and that helps them understand actually some of the difficulties they're experiencing. But it's that communication and working together and both being open and honest to everything, and if needs be, seeking outside help to enable that to be most effective.
Super. I would add we've got the beginnings of a partners of members group going, where 3 partners of members are in contact via a WhatsApp group, and if any members partner would like to be put in touch with those, it's fine. And all of us remember, until we all individually encountered a balance condition, we had no idea either. It's such a difficult condition to explain to anyone. And I think even within the medical world, we all admit there are just not the right terms, not the adequate terms to describe what we go through as human beings. So it is really difficult to explain to anyone else how it affects us, but it really does. Quickly moving on, because I'm conscious time is a ticking. A question from Dawn for Paramita. I have a question regarding medication. My ENT specialist in the Netherlands suggested that after an attack of vertigo, taking beta histamine as soon as possible, 3 to 6 months, can help with recovery compensation. They believe it increases blood flow and may have a positive effect. This is in people with bilateral vestibular hyperfunction. Is this evidence-based, and what, if any, experience does the panel have with this? Paramita, beta histamine.
Thank you, Dawn. So beta histine is a medication that is very often used in our clinics. It does, well, it's how it works is not entirely clear, but one of the ways it's supposed to do that is by increasing the blood flow in the ear. And the other possible mechanism is that it acts directly on the balance pathways that go through the brain. Now, in our practice in the UK, we tend to give it for Meniere's disease. So it's part of the medical treatment arm for Meniere's disease. So if you first present with vertigo for Meniere's, it's one of the things that is started in addition to diet modifications, lifestyle modifications. And a good number of people actually respond to it. So even though the mechanism of how it acts is not very clear, people do respond to it. And if they're responding to it, then I tend to continue the medication. Obviously, if they're not responding to it, we stop it. I must say that I don't use it for bilateral vestibular hyperfunction, but the indications for this medication may differ on the continent. So if your doctor has good evidence that it helps with bilateral vestibular hyperfunction in their center, then I think it's a reasonable thing to advise. Beta histine doesn't have a very strong side effect profile, so it's well tolerated by most people. So while I wouldn't say that there's a strong evidence, there isn't a strong evidence for many years either, but we do tend to use it. If it is helping, then it's worthwhile using it. But there is no strong evidence.
Very Good, thank you. Question from Yaz, and this is for Michaela. I would like to know for how long I can go without regular balance exercises. I feel I need a break from them ever so often. I do the Hawthorne Cooksey exercises on a daily basis when I go out every day, which control the dizziness caused by movement. Sometimes I forget to do the exercises because I feel well. Should I do the exercises regardless of how I am feeling?
Okay, so the idea of the exercises is to retune the function of the balance system. And once that tuning is done, it should be fairly stable and remain in that kind of good state, if you like. So it's not necessarily something you have to do forevermore. The exercises are effective when they are done consistently. So when there is imbalance in function that we're trying to retune, you need to do the exercises on a very, very regular basis to get the effect. Now, the difficult thing there is Hawthorne Cooksey exercises have limited benefit. They do have some benefit, but they lack the gaze stabilization exercises, which is a big part of vestibular rehab. So it may be that the exercises that you've done have retuned what needs to be retuned that they're able to. If there's any remaining imbalance, it may be different exercises that you're needing, in which case you need to speak to a suitable vestibular therapist to assess what exercises those may be. But generally, what I tend to find is that when people are forgetting to do the exercises because they feel well, it's because they're well and they don't need to do the exercises. So if you're feeling fine and you remain feeling fine, it sounds like the vestibular system's doing the job that it should be, and you can carry on as you wish to. And I would just say, just keep as active and mobile as you can and do your normal things that you enjoy doing and don't worry about it too much.
Lovely. Question possibly for both of you here from Nicola. I'm currently in a flare-up of triple PD and Mulder-Debarkmont syndrome, and it's been going on for about 5 weeks now. Is there anything I can do to settle the rocking down? I also have a head tremor, which is particularly bad at the moment. So finding the finger-eye exercises make my head tremor worse. Any advice is appreciated. Who would like to take that first?
I think Michaela should, if that's okay, Michaela.
Michaela, there you go.
Just formulating my answer there. I would probably go to start off with is the making sure you're kind of pacing yourself and you're actually giving your brain and your body plenty of space to de-stress and relax. Because any increase in stress levels can aggravate things like tremor, and it'll also make the hypervigilance to symptoms feel an awful lot worse with triple PD. Sometimes you just need to give your brain a little bit of space to recover enough to then be able to do the exercises effectively. Medication-wise, that's something I'll leave Paramita to talk about. But generally, I would just say just giving yourself a bit of a break. Maybe if you're kind of pushing yourself too hard with I must just get this sorted, it can be counterproductive.
Thank you, Michaela. The reason I asked for your input first is because with triple PD, I think medication is not really the first line. So we would want people to have the vestibular rehab, cognitive behavior therapy, etc. But if we're in a situation where we do need medication, it's usually to tackle the stress related to the symptoms, the anxiety related to the symptoms, and you can get medication from your GP or your practitioner. Certainly, what is in practice in the UK is a medication called venlafaxine, which needs to be started by a doctor and needs to be monitored. So your GP is usually the person to start that for you. But the first line management with triple PD is essentially vestibular rehabilitation and behavior therapy to help deal with the anxiety associated with the symptoms.
Can I jump in, Kevin?
Yeah, go ahead.
I'm actually already on an SSRI. I'm on fluoxetine anyway. Would there be a difference between swapping to venlafaxine? Would there be a better benefit from fluoxetine?
No, I think fluoxetine is one of the medications on the list as well. So it's a question of your doctor's practice and what is usually given and what they're comfortable with, and what your side effect profile is and your response really. So if you're getting decent benefit with fluoxetine, then that's absolutely fine. But there are a group of medications which one can switch to as well. And I say venlafaxine because that's the one that's more commonly used in our center. But any other medication from the group is good as well.
Okay, thank you.
Super. Thanks, Nicola. Right, we have a question now for Michaela. Sylvia asks, advice about flying. After arriving at the destination, my balance is affected. I feel floaty and lightheaded for about 3 days. After arriving home, I get a migraine the next day. What can I do to avoid these symptoms?
Those symptoms do sound very much like they're migrainous more than vestibular. And again, it's a case of treat the migraine to treat the symptoms. So any suitable medication that you take for migraine, potentially taking that before you fly. Travel sickness tablets, either over the counter or have a chat to your GP potentially to speak to them about something that might be a little bit stronger than the over the counter vestibular suppressant and anti-nausea. But also it's things like making sure you give yourself more time than you'd really think to be able to get to the airport and to get through all the through the queues and everything, so you've got less stress. You're not kind of sitting in a car going, oh my God, we've got to be there in half an hour and we've still got to get through security and do all of the. Give yourself plenty of time. If needs be, you can, with a lot of airports, get airport assistance where you're met at the airport and they can help you through the security and through the baggage lines and all those kinds of things. You can get sunflower lanyards that's an indicator to people that you have an invisible disability, can help people be aware that you might need a bit more assistance or a bit more support or sometimes just a bit more kindness. And yeah, just kind of preparing yourself that as migraine sufferers, we do tend to be very, very motion sensitive and we're not good travelers. And just, yeah, any medication, if needs be, the dark glasses, eye masks, whatever you need to do that helps reduce your migraines, avoiding any triggers that you can beforehand, and just taking good care of yourself with it. Give yourself way more time than you'd think and look into airport assistance.
Super. Lovely. I'd like to think this is a related question, but I don't think it is. Vimla asks, very simple, does low air pressure make the balance system worse? Low air pressure. And Paramita.
Yeah, yes, thank you, Vimla. When I was reading this question, I was wondering whether Vimla was talking about flying, basically, because obviously that affects air pressures. But I've had patients who have told me that actually the symptoms kind of get worse when they know a storm is brewing and things like that. So I think general air pressure can also make a difference to individuals. Certainly, air pressure changes can worsen migraine, and if you take into account the fact that our middle ear is full of air, which is supposed to be at atmospheric air pressure, so any atmospheric pressure changes are in theory being transmitted to the middle ear and thereby to the inner ear as well. So in theory, pressure changes can be transferred to the fluid in the inner ear and may cause changes in the balance. But again, if you're looking for evidence, there's no clear evidence regarding this. Certainly, we know that dramatic air pressure changes can cause damage to the inner ear, but those are extreme situations. So potentially could worsen migraine and could, in theory, worsen other conditions as well, but there's no clear evidence.
Yeah, I must say it's one of the most common, whether you want to call it a myth or beliefs, that seems to come up every year about the connection with our weather system and the air pressure and how people are affected. When I was going through my hypervigilance, I could even tell you what cycle the moon was in as to whether it was affecting my many. I don't know. But as you say, it affects migraine, affects the ear, it is sensitive to air. So maybe we're right to believe there is something there. From Vimla again, for you again, Paramita. And this seems to be going over the head of Michaela here with this question. I try to do my vestibular exercises, which my vestibular physiotherapist has set for me every day. Apart from these exercises, are there any medicines that can help? Bit of a general question that I would have thought, but over to you, Paramita.
No, I think it's an important question, and it draws attention to the fact that actually balance symptoms can have various causes, and whether a particular medication will work on a certain set of symptoms depends on really what underlying cause we are thinking of, and that's the key question here, really. So, for example, if the symptoms are due to vestibular migraine, then there are several medications that could help an individual. We're talking about many years, then there are other medications which can help. So there isn't, unfortunately, one medicine that would treat everything. And it really depends on the underlying cause.
Yeah, super. We have finished the members' questions, and we've now got some seasonal general questions to take. But I think I just want to check, because with asking the questions, I've not been able to monitor the chat at all. I'd just like to offer for a few minutes a chance to the audience, if anyone's got a burning question that they would like to ask, if they could put their hand up. Anyone with a question? I saw Catherine first, so I'm going to ask Catherine to unmute. There you go. Oh, sorry, you're still muted. Let's just unmute you. There you go. Go ahead, Catherine.
Hi, good day, everybody. Thank you. My question is, I've had an MRI of my hip, and I've also had portable postular, it's electromagnetic field testing and treatment. And I noticed a big flare up in my head for at least 2 days, 2.5 days to calm down, despite putting protection around my ears and my head. What is creating this, and is there anything else I can do to protect myself if I need another MRI?
That's
Paramita, is that something that you have a ready answer for?
So if I understand correctly, Catherine, you had the MRI scan, and that had a knock-on effect on your ears. Is that right?
Yeah.
And I have had MRI scans, and I find them rather unpleasant. You are in a closed space. There's a lot of noise going around. You have to lie there, not moving for half an hour, 45 minutes. When I had my first MRI scan, I got out of the scanner and I was extremely dizzy. So yeah, I understand where you're coming from. And how can you prevent that from happening? That's a good question. I mean, the next time I went into the MRI scanner, I actually took I asked them specifically if I could have some music with earplugs on. So I did that. The first time I had my head completely flat, which doesn't do well for me. So the next time I asked them for a pillow so that I could have my head supported while I was lying there. And that did work for me. I do have a lot of patients who really struggle with MRI scanners. And a bit of a sedative, for example, diazepam, 30 minutes before you actually get into the MRI scanner can make it a bit more bearable. So those are the first few things I would suggest, some of which have worked for me and some of which have worked for my patients. But because it's an MRI scan, you clearly can't wear something, more substantial over your head and stuff, because it's an MRI scanner. You can't take things in it. But if you're really struggling, I think a bit of sedative before you go in is not a bad idea at all.
And are you familiar with the portable electromagnetic field? They use it, I have rheumatoid arthritis as well, and they use it for speeding up healing for the NFL and Olympic training and that sort of thing. It speeds up the healing, and I had it on my back.
Yeah.
Again, the same thing happened for like
Right.
2.5 hours.
Yeah, I must say I'm not familiar with that.
Okay.
But I can certainly ask my orthopedic colleagues and find out what it's about and get back to you, Kevin, if that works. I
Thank
can
you so
find more
much.
information for you.
Catherine, thank you. Question Rosie put in the chat earlier, and I have found it now. I get awful many entities vertigo attacks when everything is spinning. My dad is very unsympathetic and says I should try moving around as that might help. Please could you explain why we shouldn't move during an attack, and if that is the case, I know that trying to get moving soon after attack is usually advised, but I feel like moving during an attack would only do damage and make everything worse. Paramita, comments please.
Certainly, I wouldn't recommend that you try to, go up and about when you're having an acute spell of menias or migraine, because sometimes, taking some rest and sleeping it off is the best thing. What I wouldn't suggest is that you obviously don't need to necessarily stay in bed for longer than a couple of days, I would imagine, because after that, at least a little bit of mobilization is a good idea to try to get the compensatory mechanisms to kick in. But whether it's 2 days or 3 days or 5 days is very individually determined and can depend on the intensity of the attack as well. So I wouldn't suggest that you put yourself in danger or stress by trying to move around when you're extremely dizzy. But yes, some movement as soon as you feel able to is a good thing to do.
No, good. And Rosie, if I can add, I'm a dad, and a message to your dad is when you're having a Meniere's attack, the last thing you want to do is move. I just wanted to pass out. I couldn't wait to just not be in that attack. And likewise, I used to spend up to 12 hours then dead in my bed, trying to recover from what felt like a hand grenade going off in my brain. And then slowly and surely you start moving again. So Rosie, if your father wants to have a chat with me anytime, it's quite welcome. And I'll try and explain the delicacies of it. Let me just check. Remember, I'm all on my own here. Let me just check if we can see. Oh, it's all right. I'm struggling to find the right view now. I'm trying to see all our lovely people. Just bear with me a second. Oh, has anyone got the hand up? If anyone has, let me see. Oh, yes, John and Gwen, I came to you first, so if you can unmute and ask your question, please. Lovely jumpers still.
Yeah, it's not so much a question as an observation that may help some people, if I put it to you. I also, because of my age, suffer from nocturia, have to visit the bathroom many times in the night. I've developed the habit of turning a different way each time I get back to bed. And one night, by chance, I noted that the room was oscillating because I kept my eyes open instead of closing them and trying to sleep. And it would appear possible that my movements approximate to a corrective maneuver and are removing crystals from the canals. Just a thought that maybe if that is a habit people can use, it would help them.
Ask Michaela if she can help with that one.
Yeah.
Can Michaela help with that one? Do you think that's right?
So what you're talking about potentially sounds like if you've got BPPV, so calcium crystals loose in the ear, kind of the way you get up from bed can potentially maneuver these crystals around, which, yeah, potentially. If, for example, if you've got crystals loose in the right ear and you then turned over onto your left and then went to sit up and rolled a bit further and sat up, essentially, yeah, that's potentially very similar to an Epley maneuver if you get the movements just right. And it'll be depending on which ear the crystals are loose in, depends on which direction you need to go to. Essentially, the kind of rule of thumb is that you need to roll away from the bad ear to treat it. But yeah, the difficult thing with home Epleys is that when you're dizzy, your brain doesn't know where you are in space. And what it really, really wants you to do is to sit up and get out of that position. There is the possibility when you're doing home Epley maneuvers that you're not getting your head into the correct position. And if you get them into the wrong position, that can get them into a different canal, which can make things feel much worse. So yes, what you're suggesting with the getting outside of the beds at different size potentially absolutely could work as a home Epley if you happen to be getting it in the right position.
Very good. Thanks, John.
Thank you.
You have won the prize for the best Christmas jumpers this year.
Thank you.
The prize will be announced at a future date.
Okay.
Thank you very much. If you
Happy
can
Christmas, everybody.
mute again now, please, if you go on to mute. Right, we have time now just for the last three seasonal questions for our experts. The first one is, and this is to both of you, what good news can the balance community look forward to regarding treatment or resources within the NHS next year? Paramita, you go first on this one. What good news can we have for next year?
I think one of it has come up during this discussion that one of the big challenges we have is how long we have to wait until we see our balance patients and until the balance patients see us. So I'm certainly hoping, because there has been some injection of funds into the NHS and into the balance service, particularly in our institute, where we are hoping to recruit another 2 balance consultants in the next few months. So that is, from our point of view, that's brilliant news, because we will be able to see many more and reduce our waiting list. So yes, resource in terms of personnel, we are hoping. So I'm looking forward to a good 2025 in our balance centre.
And Michaela?
As Paramita says, we participate in a balance symposium each year, and year on year, and this has been going for 21, 22 years, something like that. Each year we're getting more and more medical and allied health professional interest in joining us and learning about balance and training to do really, really well in all things balance. So from consultant level through to a variety of audiologists, physiotherapists, all kinds of people that are needed to help treat balance. So much more interest now and so much more enthusiasm. So hopefully the numbers of professionals available to be able to consult to will gradually be increasing. And the depth of knowledge that we have is always increasing. I know Peter Ray's mentioned previously things like there's a lot of research into things like a similar to a cochlear implant, a vestibular implant. Obviously, this is in research stages at the moment, so this isn't going to be a 2025 thing. But all of these kinds of things all add into the future of balance is looking brighter and brighter than it ever has previously.
No, that's excellent. Excellent news. Next question for both of you. We've touched on this before. If waiting times to access diagnosis treatment are as long as they are, what general advice can you give without knowing a person's specific condition, because they wouldn't if they've not been diagnosed? What can they do at home or research or practice to stop themselves going completely mad because they don't know what's going on, but they're living with some form of balance problem? What can you advise they can do whilst waiting to see you good people? Michaela, first one, you on the rehab side.
I would start off with just stating that diagnosis is paramount. Knowing exactly what you are dealing with means that you are going to get it dealt with most effectively. Everything from this point is generalized from there. Keep your head moving. The worst thing that you can do is start doing all these kinds of movements. Try and keep your head mobile as you can, even if it doesn't feel that nice. Try and keep doing it little and often. Little and often and consistency is the key to everything. Just gently keep plugging away at it. Daily walks are brilliant for everything. It's good for the balance. It's good physically to keep your muscles strong and supple. It's good mentally. So daily walks is as best as you can, even if it's just out into the garden and back again, or even just in parts of your house. Keep walking. Kind of that mindset can make a big difference, knowing that, okay, things are difficult at the moment, but things will get better, things will get tackled and diagnosed, and appropriate help given is coming. You will get there and things will be better than they are now. And just keep as mobile as you can and keep looking after yourself.
Super. And Paramita.
I think I absolutely agree with Michaela. The primary thing really is that there should be a form of diagnosis before you start waiting for a further appointment. So do see your GP. They should be able to rule out, within quotes, the worrying causes of dizziness, which means that they should rule out anything that might be affecting your brain, etc., which could progress in quickly, and we don't want you to be waiting with that kind of a condition. So diagnosis is paramount. If your symptoms are stable after a diagnosis has been made and you're waiting for further specialist input, then everything that Michaela has said applies. The one thing I would suggest is that if you notice that your symptoms are getting worse, please go back to your GP service to try and see if they can expedite things for you.
No, very good. Then we come to the final question, and light-hearted but serious and possibly really difficult to answer. What would you both recommend as a New Year's resolution for someone with a balance condition to aim to achieve to do throughout 2025? So what would be that one New Year's resolution? And good luck with that. We'll start with Michaela.
You limit me to just the one. That's not fair.
No, we'll allow multiple answers here. Go on.
Okay.
Give us several.
So the first one I would go for isn't necessarily actually anything to do with balance, but I think as a good all-round thing for everybody is take note of the good things in your day. Even when things are really tough, there'll be some random little bright spots, whether it's something that somebody says to you that's just nice, or that you spot that the first daffodil has bloomed. Making note of these little bright spots in the day can make dealing with an incessant, difficult condition that little bit easier. It takes up a little less space when there's something bright in the day that you make notice of, because we're very good at just ignoring these things and putting a lot of notice onto the bad things. The second one I would go for is, again, I'm reiterating, take yourself out for little walks. It's good for everything.
No, super. I would just add to that, my biggest thing for all people with any sort of balance condition, which is so difficult during the bad times, always keep that hope, because things will get better. If you think about your whole life that's gone before today, nothing ever stays the same. So you might be in the most dreadful period of bad symptoms. It's not going to stay forever. So maintain that hope, because that can carry you through most things. Secondary to that, we've touched on this before, you've got an illness, put yourself first. You can't do what you used to do when you've not got that illness. So be kind to yourself and let people know what you can't do and you're not prepared to do. And then one personally for me, my resolution is I've got to try more different types of Rioja red wine next year to discover which one is the best for improving blood flow to the ear. And that's it. Thank you so much, Paramita and Michaela. You've been brilliant. If I might add, the questions from the members have been equally as brilliant as well. We've covered so many things. It just remains really to say you can all come off mute now, and I'd all like to wish you a brilliant Christmas that's coming up. We will meet in the new year. It's normally beginning of Feb where we'll get together. And for the new members, you'll get an email next week with a link to the recording of this. So anything you may have missed or want to check again, you can. So I better put my silly hat back on and wish you all a great Christmas. Thanks for being here and sharing with it. Thanks for making the group what it is. Thanks, Michaela. Thanks, Paramita. It's been brilliant. And we'll see you all next year.
Thank you, Kevin.
Happy Christmas. Thank you.
Merry Christmas.
Merry
Thanks,
Christmas.
Kevin. Well done for being on your own.
Yeah.
Next year.
See you next
Be
year.
good. Bye-bye.
Bye.
Bye.